Correct documentation is a key element in preventing medication errors. If you fail to document your medication administration correctly, a range of errors could result. For instance, another nurse could give your patient a second dose of the drug you already gave, or the patient could receive a PRN dose too soon. When documenting medication administration on the patient's MAR, include the name of the drug, the dose you gave, the route you used to give it, the time you gave the drug, and your signature or initials. If you gave a drug by injection, also include the site of the injection. If you checked the patient's lab values before giving a drug, document this step in your nursing notes. Also, describe any pertinent patient teaching you performed and the patient's response to the medication you gave. Make sure to sign, date, and time your entries. In addition to documenting medication administration, you should also document the lack of medication administration. If you don't give a medication, circle the dose in the MAR and then document the reasons why you didn't give the drug. For example, you may receive orders to withhold the drug if the patient's heart rate goes below 60 beats per minute. Besides protecting your patient's safety, quality documentation can also protect you. If a complication arises, a patient or his family members may request a copy of his medical record. Thorough and accurate documentation will protect you from liability if they do. So will remembering to avoid certain pitfalls of documenting drug administration. For instance, don't document an action before you take it. Don't chart at arbitrary times. Instead, document your actions immediately after you take them. Don't chart for someone else. Doing so could make you liable for that person's inappropriate or incorrect drug administration. Don't forget to document any patient teaching you provide about drugs or their administration.